My name is Mel Recchia and I'm the lead nurse for Cosmetic courses. Prior to any treatment regime that you're going to be carrying out, it's very important that you do a skin assessment. Now, your skin assessment will vary and it will depend on the treatment that you're planning to carry out with your patient. But there are a number of sort of general things that you would be looking out for during this. Prior to the actual skin assessment, you will have carried out a medical questionnaire as well, because we need to know the medical background of people. We need to know whether they're on any medications or what sort of vitamins and supplements they may take. And then depending on the treatment that we're going to be carrying out with them, we will need to look at various things about the skin. So we need to look at the age, we need to look at their current regime, what do they currently use on their skin. We need to look at their lifestyle and whether there are any things in that will impact on the quality of their skin. Then we need to start breaking it down into more specific skin conditions. So we would be looking at the skin to look at the different areas of the face to see whether they have any problems such as acne, whether that is a severe case of acne, in which case we might have to think about referring them on to other agencies for treatment or maybe refer them to their GP. If it's a mild case of acne, then we would look at the treatments that we could offer that will improve the skin condition. So we're going to be looking at whether the skin is very dry, whether they have an oily skin, whether they have open pores. We look at the thread vein situation because there are some treatments that we do that may exacerbate this problem. We would look at the pigmentation that they have in their skin, and all of these different things together will also direct us into the most appropriate treatment for that person. One of the scales that we might use when we're assessing the skin is the Fitzpatrick skin type scale, and this looks at the colour of patients' skins and their sort of tanning ability. On the Fitzpatrick scale you have level 1 to 6. Level 1 would be the palest of skins and level 6 would be the darkest of skins, and then the scales in between. And by determining where a patient falls on this scale, this will determine the best, most appropriate treatment for them. During your consultation with your patient and during your assessment of their skin, this is the perfect opportunity as well to educate them in their ongoing skin health. So not only will the success of their treatments be from what you will actually do within clinic, but also to maintain those results, they will need to be educated in what they can do at home to carry on those results and to also increase the longevity of those results and to maintain that good skin. Because skin is essentially an organ and it does renew itself on a 6-week basis, any treatment that a patient has to be maintained. So they will have a course of treatments with you, but they will also need to do a degree of home care as well. You can't really just have a treatment in clinic and expect that that's it. So you'll also have to educate them to a regime that they can use at home. And I think you have to be realistic with this because you'll have some people who will have time to spend on a more detailed regime, and you'll perhaps have somebody who's a very busy person and may need just the basic regime. So this is something that you will discuss with your patient during your consultations. But it's very important to educate them because ultimately what we're doing is we're trying to look after people's skin, we're trying to keep them as looking as well and as healthy into their sort of older age, and part of this is looking at their lifestyle as well. So advising people of the need for sun protection, for instance, sun protection every day of the year. If they use sunbeds, warn them of the dangers of sunbeds, not only from a skin aging point of view but also from a skin cancer point of view. And just generally, smoking perhaps, just advising them of what is a good thing, what is not so good for them to do, so that you can have an overall best outcome from all of the treatments that you're going to provide. So in summary, it's very important before any treatment regime to do a good skin assessment, and this is the opportunity for you to get to know your patient and to work out between you what the best treatment regime is going to be and what the best treatments will be for that particular patient. So your skin assessment will have specifics to the treatments, but generally it gives you an overall picture of what you're going to be doing with that patient.